Hello, I'm Judson Brandeis, board-certified urologist and Hive 80 member. The following content was created by the Urology Care Foundation. Now, what about radical prostatectomy or surgery for prostate cancer? There are 3 types of radical prostatectomy surgeries, but the robotically assisted laparoscopic radical prostatectomy with the Da Vinci surgical robot is the most common type of prostate cancer surgery done today. The surgeon is assisted with a robotic system that holds and guides the laparoscopic surgical tools and camera. It also allows the prostate to be removed through tiny ports placed in your belly. In experienced hands, the robotic prostatectomy have great outcomes. There is also less blood loss with robotic surgery than with other methods. The success of this surgery depends on how experienced your urologist is. The more surgeries he or she has done, the likely better she is at this surgery. After the prostate has been removed, the urinary tract and the bladder are reconstructed. A catheter is passed through the urethra into the bladder to drain the urine while the new connections heal. 1 or 2 suction drains may be left in the pelvic cavity after surgery. They are brought through the lower belly to drain fluid from the wound. They help lower the risk of infection. The drains are usually removed before you are discharged from the hospital. After surgery, your surgeon will review the final pathology report. Together, you will make plans for the next steps. The main benefit of a radical prostatectomy is the prostate cancer removal. This is true as long as the cancer hasn't spread outside the prostate. Surgery also helps the healthcare provider know if you need more treatment. The goal of surgery is to get a PSA value of less than 0.01 for 10 years. Surgery is often a good choice if the prostate cancer has not spread beyond the prostate. But surgery always comes with risks. Some complications from surgery can happen earlier and some later. Bleeding or infection can happen with any major operation, so you will be monitored to prevent or manage these problems. Not everyone has the same side effects for the same amount of time. With surgery and radiation therapy, there are 2 main side effects to consider: erectile dysfunction and urinary incontinence. For some men, surgery can relieve pre-existing urinary obstruction. Most men with these side effects find ways to manage them over time. All men have some form of erectile dysfunction after prostate surgery. Erectile dysfunction is the inability of a man to have an erection long enough for satisfying sexual activity. Nerves involved in the erection process surround the prostate gland, and they can be affected by radiation treatment. The nerve bundles help control blood flow to the penis. The length of time erectile dysfunction lasts after treatment depends on many things, including how firm your erections are before treatment. Sometimes it may take 1 year or longer to recover erectile function. In the meantime, your doctor may have erectile dysfunction treatment options for you. If it's possible, nerve-sparing surgery may help prevent long-term damage. Older men have a higher chance of permanent erectile dysfunction after this surgery. Now, it may surprise you to know that men are still able to have an orgasm or climax, even after a radical prostatectomy. An erection is not needed to climax. There will be very little, if any, fluid with an orgasm. In addition, you can no longer cause a pregnancy after surgery. This is because the prostate, seminal vesicles, and connections to the testicles were removed, and the vas deferens was divided during surgery. Planning for fertility preservation in advance of surgery is an option for men who want to have children. It is important to know that sexual desire is not lost with this surgery or radiation treatment. The exception to this is if hormones are also given as part of treatment, usually given temporarily with radiation therapy. This is Dr. Judson Brandeis, urologist and Hive 80 member. Thank you for your attention. Tune back in to Hive 80 for continual medical and wellness information. Wishing you the best of health.